Of all the billing you may have to deal with in the course of your workday, PIP billing might be the most diverse. It might also be the kind of billing that will require the most attention. Think about it for a second. If you work for a medical practice or other care provider and you bill Medicare and Medicaid, or maybe just Medicare, everything's going to one source. It's pretty easy to do, and maybe you can get away with some distraction. But with PIP, or Personal Injury Protection billing, associated with the Michigan Auto No-Fault System, you might be billing 15, 20, or 30 different companies. You might be dealing with 30 or 40 different representatives of those companies, not to mention having to justify certain costs to the Michigan Catastrophic Claims Association. So this video serves one purpose, giving you an important tool, and that is your resource binder. Your resource binder will kind of look like this. Yes, it'll have dividers on the inside of it. And what should you have in that resource binder? And ideally, by the way, it's going to be a 3 or 4 inch binder. Number one, general case information. So you know what everybody is receiving. Your understanding specifically what services are being rendered will complement your billing activity. Number two, treatment plans. You can go down there and exactly see what somebody needs. So even though you may not be a clinical professional, in your conversations about reimbursement, you can draw attention to what is being delivered. Then number three, says it right here on the binder, adjuster communications. What you're doing is making detailed notes of every communication you have with anyone who has authority of how you get reimbursed. In that way, you can draw attention to those previous conversations in an effort to make sure that you stay in line with what's been approved. Disability certificates are the next one that's going to be in there. And again, everybody has their own divider, and you might be using some post-it notes or other things to keep things in certain date sequence. But that certificate certifies what a physician says is required based upon this person's condition and their last medical examination. And then look on the binder again, there's a number 5. Physician changes. Maybe a phone call, an email comes in, the physician adjusts the number of hours of attendant care, etc. As a competent biller, you can't be sitting around going, oh my goodness, what date was that? Absolutely not. In order to deliver your services competently and to make sure you are executing in a competent manner, you will have to document, yes, catalog communications so that any changes that are requested by the attending physician, be it the physical medicine and rehabilitation physician or some specialty physician such as a neurologist, you have it date and time stamped in your records, so when you have to adjust billing, you can do so without significant research or delay in reimbursement. After all, that money coming in the door is the lifeblood of the business you serve. There will be more presentations like this, but please use this one to get started in a proactive and productive way, knowing we're always here when you need more.